I think as physicians, there's so many things that we can do to help reduce the health disparity gaps with these patients. I think the first thing to do is to really look at our own implicit bias when we're treating the patients. We have to recognize that a lot of these patients historically, especially minority patients, Black individuals, have a mistrust in the healthcare system to begin with. So we're trying to develop a rapport with these patients, and we want them to understand the significance of an RA diagnosis and the necessity for aggressive treatment. We have to recognize that we need to build trust with these patients initially, because without this trust, these patients will not take the medications, or they may not want to research the medications that is needed to help with these therapies. Another reason could be lack of resources, whereas some of these patient populations may not have access to technology or the resources in order to research the medications or even the RA diagnosis as well. A lot of these patients may feel like this is just a joint disease and they can just get over the pain or they can get over the joint symptoms. Whereas we all know that RA can involve other organs like the heart, lung, eyes, nervous system, skin, abdominal system. So there's so many other systems involved that it's important that these patients recognize that not only they are not treated aggressively, they will have physical disability, but they may also have other organ involvements, which can lead to significant morbidity and mortality. Also, I do feel like a lot of these patients need to have more time with the physicians to talk about the risk and benefits of these medications, because they are complex. The immune system is such a complex system. And for these patients to recognize that although some of these medications do have side effects, like every other medications, they have to weigh the risk and benefits of this medication, again, to prevent physical disability, as well as other organ involvement, and also depression, which kind of is associated with RA diagnosis if left untreated. So there are so many steps, but I think really fostering a better patient and physician relationship, empowering the patients to take control of the disease and be an engaged participant in their care is really important. And I think that all kind of starts with recognizing implicit bias and what we can do to recognize cultural beliefs of the patients and their ethnic and cultural backgrounds, and how that can play a role in whether they proceed with treatment.